Equine Cushing's disease, best described as pituitary pars intermedia dysfunction. Cushing disease is an aging disease. If horses live long enough, they are very much likely to get some degree of Cushing's. The aging affects the brain, which has a domino effect in many of the glands, particularly the pituitary gland, which subsequently affects some body functions and organs. In this short video, I'm going to discuss what is Cushing's, what signs we have to look for, how can we diagnose it, and treatment and management. Being an aging disease is going to affect all the horses, generally from 17 years onwards. It can affect younger horses, but the average horse will be around 20 years. Is it on the increase? Probably not. There's been a huge awareness, huge campaign of Cushing's. 15 or 20 years ago, it was almost unrecognizable, and it would have passed in many occasions unnoticed and untreated. Also, horses live longer and therefore more likely to get Cushing's. Ponies may appear to show more signs of Cushing's, such as hirsutism, long hairy coat, but ponies are more prone to have longer coat, which makes them a best target for diagnosis. Horses and donkeys, they may not show so clearly. The clinical signs can be quite variable, and although there is some symptoms that are linked to Cushing's, there's many others that could be secondary, and horses in general can become more vulnerable to other problems. So what is Cushing's? Years ago, and influenced by human medicine, Cushing's was thought to be a tumor in the pituitary gland. Dr. Cushing's, an American eminent surgeon, would develop a procedure to remove this tumor at the base of the brain through the mouth. However, through the years of research, we now know that Cushing's is a dysfunction of the pituitary gland, which may cause enlargement of this gland or hyperplasia, but very rarely develop itself as a tumor. In some older horses and ponies, the hypothalamus at the base of the brain will undergo progressive degeneration, and it will produce insufficient quantities of a neurotransmitter called dopamine. Dopamine is very important controlling the pituitary gland function, particularly the pars intermedia, which gives the names to the disease. Subsequently, as a domino effect, is going to affect all the glands, particularly the adrenal gland. This gland produces cortisol. The disease is going to lead to high secretions or high levels of cortisol, which will also cause, amongst all the symptoms, insulin resistance. So in conclusion, we're going to have degeneration of the brain, which is going to affect the pituitary gland, causing endocrine instability, which subsequently is going to increase the levels of cortisol and insulin resistance. So what are the clinical signs of Cushing's, which I'll call from now on PPID. Horses with PPID will show a wide range of clinical signs. Most of them are caused by the high levels, if we remember, of cortisol. Generally, the first common observed sign is that you have 1 or 2 summers where the coat hasn't changed appropriately, and they start to develop this long, curly, overgrown coat. This is what we call hirsutism, and I believe this is one of the most reliable single indicators of PPID. Some horses, they also have some sort of abnormal fat distribution, so they may get fat deposits in certain areas like crest of the neck, top of the back, or the sheath sometimes, and above eyes in the supraorbital area. Also, as an effect of high levels of cortisol, they start to drink and urinate excessively. Horses and ponies, they become on a catabolic state, which means that they start to lose muscle mass and they start to develop this pot belly appearance. They tend to sweat excessively due to the long coat, and they find quite difficult to regulate the temperature. Chronic laminitis, which I will explain in a minute. These horses and ponies, they're going to be immunosuppressed. Again, secondary to the high levels of cortisol. They're going to have depressed healing response, so wounds are going to heal slowly. Any kind of wound, or even corneal ulcers, they're going to be very difficult to treat. They are prone to periodontal disease. Some of them, they be lethargic. They may not join in a group or socialize in a normal way. And there's furthermore clinical signs like low fertility, or they have inappropriate lactation. I have attached 2 pictures, one showing the Belgian supraorbital fat quite clearly, and another horse with clear signs of Cushing's with a long curly coat. There is also a gory picture of periodontal disease of a horse that was also affected by another dental disease called EORTRH. Laminitis is ultimately the most potential devastating condition of PPID, and we certainly want to get there before they develop laminitis, acute or chronic laminitis. In some horses or ponies, it could be an initial sign, particularly they develop laminitis around the unusual times of the year, such as October, November time. Laminitis can be quite common in horses with PPID, less so in horses that are treated, but between 50 and 80% could get laminitis, and we can blame laminitis again on the high levels of cortisol and the subsequent insulin resistant, which is going to cause high levels of insulin into the bloodstream, which directly will cause laminitis. And in my opinion, it would be unfair to keep a horse or pony with recurrent chronic laminitis if it's untreated. How do we diagnose PPID? We can diagnose it on the clinical signs alone. As a general rule, if we have 3 clinical signs, it's enough to commence treatment. Typically, we can get signs like hirsutism, pot belly appearance, and laminitis, which will warrant treatment, but also they give you an idea of the degree of PPID and therefore the amount of treatment or the dose we required. The golden standards of testing would be the ACTH, would be produced at high levels in a horse with PPID. When we test them, we compare the levels with the reference range. As we can see from the graph, the reference range change through the year. So we would find that in autumn, the reference range is higher. So the levels of CTH, they are higher. And this is quite an interesting time of the year to test, because some horses that are borderline Cushing's, they may only race above the reference range around this time of the year. So the general protocol for the bloods would be to perform an initial test to diagnose PPID. We will commence treatment. We would take another sample in 6 weeks' time, and we'll be hopefully satisfied that we're giving the right amount of medication. We generally repeat the samples and we follow up. We have to remember that PPID is a degenerative disease and therefore is likely to get worse through the years. We recommend 6 monthly samples, and I think it's quite important that we take these samples at the same time of the previous year. This will give us a more reliable comparison. Some horses, they may have signs of PPID and they have a negative result. In those horses, it is recommended that we do another test, a TRH stimulation test. The reason is that the complexity of how PPID works, and in some of these horses, this will show a positive through this test, which is a bit more specific. There is also another test we used to use years ago called the dexamethasone suppression test. It's a very good test. However, there was an added complication, which is that dexamethasone as a corticosteroid could actually worsen any symptoms temporarily. So we rely now in the other two tests. Treatment and management. PPID is going to be generally a slow progressing degenerative problem, and horses or ponies will require special attention and also lifelong treatment, which is going to mean a financial commitment. When treated, horses are going to improve the clinical signs, and some of them are going to find like a lease of life. If untreated, there are going to be increasing amount of problems. The worst, laminitis. The drug of choice is going to be pergolide, which is a dopamine agonist. There's been other drugs, as mentioned there, but some of them are not so effective or very expensive. And in the UK and in many countries, this is the best choice. We generally commence treatment with small doses to avoid side effects and increase the dose depending on laboratory test results. Although treatment is going to help these horses, it's not going to be enough to manage all the complications of PPID, and they're going to need to be monitored quite closely. Body clipping is very important, as they are not going to be able to regulate the temperature very well. They're going to be prone to infections, food abscesses, so dental care, food care, it's quite important. And also nutrition. They generally need a decent amount of feed with high quality protein. Some horses, they'll have some degree of equine metabolic syndrome or other problems, so the amount of caloric intake, they have to be tailored individually. We have to monitor these horses through life, as treatment will help, but will not cure PPID. And we recommend reassessment every 6 to 12 months, whether it's for a blood sample or the vaccination or a checkup, just to see body score, lameness, possible signs of laminitis, and performs any further blood samples if required. So the take-home message from this short talk would be that it is a complex degenerative disease, that not only medical treatment but also management is very important. There is predisposing factors, for example, horses with equine metabolic syndromes, they are more likely to get Cushing's, or obesity as well tend to be a problem, and laminitis is the most devastating and worst complication, and the one to certainly avoid. Thanks for listening.